Now let's cover the steps involved with the operation of the CHEETAH NICOM monitor. To turn on the monitor, press and hold the green power button located in the lower central area of the CHEETAH NICOM monitor until it beeps. Once the monitor is turned on, it takes about 50 seconds for the monitor to boot up. The optimal order of operations is to turn the monitor on first, then apply the sensors to the patient. Once the sensors are applied, the monitor should be ready for you to enter the proper patient data. Once the monitor is powered up and the sensors are applied, the next step is to enter the patient data. The main menu will appear on the monitor screen with the options of selecting an existing patient, adding a new patient, changing the settings, or shutting down the monitor. To add patient information, select Existing or New Patient. The CHEETAH NICOM has numerous hours of memory that allows for storing patient data within the monitor. If a patient has already been entered, select the Existing Patient option. For new patients who have not had monitoring with the CHEETAH NICOM system, select New Patient. The device will list any existing patients stored in the device's memory. If selecting an existing patient, a list of patients will appear on the screen. Ensure proper selection of the existing patient from the list available by reviewing the patient ID and name provided. To select a patient from the list, touch the screen for the proper patient. Confirm the data entered for this particular patient is correct, then select Run to start monitoring the patient. To add a new patient, select the New Patient option from the main menu screen by touching the screen in the correct location. The CHEETAH NICOM system will proceed through the various screens so the proper patient information can be entered. After entering each piece of information for the patient, tap the Next button to enter the additional information. When all of the information has been entered, select Finish. Note that patient ID, age, weight, height, and gender are mandatory data that needs to be entered for each new patient. This is mandatory since the cardiac index and stroke volume index parameters incorporate this information into the calculations. Entering first name, middle name, and last name are optional data points. We will now review the entering of data for new patients on the following slides. After tapping the New Patient on-screen button, the CHEETAH NICOM system will guide you through the process, starting with entering the patient ID. Once the patient ID is entered, select the Next button. Next, the Age entry field will appear. Use the on-screen keypad to enter the age of the patient, and then select the Next button on the touch screen. The next data element to enter is the patient's weight. Enter this in the same way that the patient's age was entered, and then select the Next button. Patient height is entered in the same way as the prior data elements, and again click the Next button when completed. The last required data element to be entered is gender. That may be selected by tapping the radio button for the appropriate gender for this patient. After selecting the gender, you can either select the Next button to proceed to the optional data entry fields of first, middle, and last name, or select the Run button on the touchscreen to begin monitoring. As mentioned, patient first name is an optional field. If a clinician chooses to enter this information, type the name in, then select the Next button on the touchscreen. Similar to patient first name, patient middle name is an optional field. If a clinician chooses to enter this information, type the name in, and then select the Next button on the touchscreen. Finally, last name is also optional. If a clinician chooses to enter this information, type the name in, and then select the Next button on the touchscreen. Once all the data is entered, a patient review screen will be shown on the monitor. Review the information to ensure it is correct, and if so, select the Run button on the touchscreen to begin monitoring the patient. If the data is incorrect, select Update Details to edit the data, and then select Run to monitor the patient. Calibration automatically occurs upon initiation of selecting the Run button on the touchscreen to begin the CHEETAH NICOM monitoring. Calibration takes about 2 minutes. Ask the patient to be still and not to talk while calibration of the CHEETAH NICOM is in progress. A red bar will appear on the top of the screen, stating that the calibration is in progress. At the end of calibration, manually enter the map from the A-line or bedside monitor to obtain TPR and TPRI if you are not using the CHEETAH NICOM NIBP cuff. Note, the system needs to be recalibrated after replacing sensors, which should be done every 48 hours. To ensure optimal operation, check the sensor placement and date of sensor placement at the beginning of each shift and recalibrate. Check sensor placement and the date of sensor placement when hemodynamic numbers are in question and recalibrate. Once the sensors are replaced, to recalibrate, select Menu Box, Test Controls, Automatic Calibration. Other situations to consider if or when to recalibrate the CHEETAH NICOM system are: when sensors come off or are replaced, the system must be recalibrated. Sensors have a lot of flexibility where they can be placed in the 4 quadrants. However, once they are placed, the system must be calibrated from that position. Always check sensors after each shift or after patient movement, and if they needed to be reconnected, recalibrate. On the other hand, you do not need to recalibrate if the lead wires disconnect during movement, and reconnect afterwards to prevent accidental pull-off. To change various settings such as height and weight, or day and time on the CHEETAH NICOM system, first access the main menu. The main menu is located on the home screen or on the lower left-hand corner of the touch screen when monitoring a patient. Once the main menu is accessed, to change settings, select the Settings button. Use the touch screen to make the desired changes. Height can be changed to a different number or to a different measurement such as inches or centimeters. The patient weight can be changed, and also the measurement can be changed such as pounds to kilograms or vice versa. Once the desired changes are complete, select Apply and then OK to return to the home screen to begin or continue monitoring. Follow a similar path to change the date or time. First, access the menu screen as previously described and select Settings. Next, select Menu in the bottom left-hand corner. Select Date and Time from the menu options and update the information to the desired date and time. Select Apply and OK to return to the home screen. There are numerous screen display options on the CHEETAH NICOM monitor. The Run Screen, Dashboard Screen, Numerical Display Screen, and Trends Display are options that can be shown on the monitor depending on user preference. These various screens show many of the same parameters, such as stroke volume and stroke volume index, cardiac output and cardiac output index, total peripheral resistance, and more. The Run screen primarily shows the stroke volume, heart rate, TPRI, SVI, and shows the actual cardiac output signal from the sensors. The dashboard screen shows more parameters, and the numerical display screen shows the parameters in a different format, while also showing the various challenges and impact of those challenges on the screen. The Trends display screen shows similar information as the numerical display screen, though in graphical format. The menu option shown in the lower left-hand corner of the CHEETAH NICOM touchscreen display allows a user to navigate through the various settings, as well as to initiate protocols for passive leg raise and fluid bolus. Selecting the menu box will open numerous options. The Event option allows different events to be entered. An example of an event would be dobutamine started at 2 micrograms per kilogram per minute. These events will be marked on numerical and trend screens. For the non-invasive blood pressure option, select Blood Pressure on the menu. A clinician may initiate, end blood pressure, or change the time interval to every 1 to 90 minutes. Select the option to initiate continuous oxygen saturation readings when probe available on the CHEETAH NICOM system. View may change grid parameters on the dashboard screen. Test controls to initiate calibration or pause the monitor. Protocols for passive leg raise or fluid bolus protocols. Manual data entry to enter MAP, oxygen saturation, or hemoglobin. When the latter two are entered, DO2I will be displayed. Switch display in order to display different screens. Exit to turn the monitor off. There are 2 types of fluid challenge protocols in the CHEETAH NICOM system. Passive leg raise or fluid bolus challenges are optimal ways to assess the fluid responsiveness of a patient. Passive leg raise, or PLR, is a bedside maneuver that mobilizes the equivalent of approximately 200 to 300 milliliters of blood sequestered mainly in the calf veins back to the heart. It is quick, safe, and reversible. A positive PLR test, increase of greater than 10% in SVI, indicates that the patient is on the ascending limb of the Starling curve. PLR has been validated to have excellent sensitivity and specificity to determine fluid responsiveness. To perform a passive leg raise with the CHEETAH NICOM system, access the main menu and select Protocols, and then PLR. The first step with either the PLR or fluid bolus protocol is to establish a baseline. The baseline will then be compared to the challenge parameter values from the PLR to determine if the patient may be fluid responsive or not. The baseline phase will run for 3 minutes, and you can track the time on the upper right-hand corner of the screen. Once the baseline measurements are complete, the CHEETAH NICOM system will direct the user through the remainder of the PLR protocol. Directions are clearly visible on the touchscreen to accommodate the patient to supine position and elevate legs to 30 to 45 degrees. Please ensure the PLR remains passive by asking the patient to lie still and allow the legs to be raised. Once the PLR protocol is complete, the PLR protocol report will be shown. This report will highlight the change in stroke volume and cardiac output from the beginning of the PLR challenge, and also indicates where the patient resides on the Frank-Starling curve. Also, note that the percentage delta in stroke volume is shown on the PLR protocol report. Performing a fluid bolus challenge with the CHEETAH NICOM system is similar to performing a PLR protocol. Access the menu screen, select Protocols, and then Bolus. As with the PLR, a baseline measurement will first be taken. The baseline measurement will run for 3 minutes, and you can track this time on the upper right-hand corner of the screen. Once baseline is established, follow the directions on the screen for completing the fluid bolus protocol. The bolus protocol phase will run until the user stops it. The timer in the upper right-hand corner starts at 0 and moves upward. To end the challenge phase, access the menu in the lower left-hand corner and select Protocols and End Bolus. Once the bolus protocol is complete, a bolus protocol report will be shown on the screen with the same parameters shown as on the PLR protocol report. Again, this report highlights where the patient resides on the Frank-Starling curve, as well as the delta percentage change in stroke volume, which is important for assessing fluid responsiveness of the patient. As previously mentioned, events can be added on the CHEETAH NICOM monitor to be incorporated into the patient record. Examples of events are fluid administration, or administering medication to the patient. You can add an event to the patient record, such as medication administration, fluid administration, and more. Detailed instructions are available on the system screen. The CHEETAH NICOM system provides instructions on how to enter the information for each particular event. To end monitoring for a patient or to shut down the system, access the main menu in the lower left-hand corner. Select the Exit button and then Shut Down. Congratulations! You have now finished the course.